So yeah, I'm delighted to be presenting this work on behalf of an amazing team of interprofessional health education researchers, Lynn included. And I would also like to acknowledge the traditional owners of the land on whom we meet today and pay my respects to elders past, present and emerging. And also would like to acknowledge the Faculty of Medicine and Nursing and Health Sciences Teaching and Learning Grant Scheme from which this project was funded. So starting a new job is an example of a transition, and we can all remember back to our first job as healthcare professionals or researchers. And in our study, we're particularly interested in the transition that healthcare graduates take and make in moving from final year student into early career practitioner. We know that transition can be quite hard, emotionally challenging, psychologically challenging. And we certainly know that some healthcare graduates feel underprepared for some areas of practice or unprepared. And we don't really know though, for a range of different health professionals, have a detailed understanding of how graduates conceptualise transition, particularly in relation to preparedness for practice, and how this changes over time as they emerge into their first role. And so our study sought to explore how healthcare graduates conceptualise preparedness for practice and how these conceptualisations change as they experience the transition from student to employee. So we conducted a 3-part longitudinal qualitative study with learners from 4 different disciplines, including nutrition and dietetics, medicine, nursing and pharmacy. And this was a novel part of our study, and we purposefully chose those different disciplines based on their different kind of work roles and work experiences upon graduation. We started by speaking to participants in interviews, either individual interviews or group interviews at the end of their degree, and asked them, what preparedness for practice means to them. We then invited them to participate in a longitudinal audio diary, where every week we kept in touch with the participants over 3 months, about 3 months, and where we prompted them to tell their stories about their transition experiences, and collected those audio recordings and transcribed those audio recordings over that period of time. And then finished in the last phase with a final interview, again, either as an individual or a group interview, and whether their thoughts of transitions, preparedness for practice had changed based on their early work experiences. For the participants, we retained lots of them over the period of time, and they had very different work experiences. Some had been working for a couple of months, others were still looking for a job. And so we then, with all that data, applied a framework analysis approach as a team to look at the data cross-sectionally and also longitudinally, and exploring particularly what we're presenting today is the conceptualizations of preparedness. So there were 13 different conceptualizations of preparedness for practice, and I'm not going to go through them all in detail, but just highlight a couple of key findings that came out. So the ones in bold there was the most stable conceptualizations of preparedness for practice over time. So over time, the graduates and students talked about conceptualization as an experience, preparedness for practice as an experience, as knowledge and as confidence. And this was something they talked about over the 3 data points. There was a little bit of difference, but not significant major difference across the different health professions, where, for example, self-awareness was something that the medical graduates spoke more about as their conceptualisation of preparedness. The dietitians conceptualised employability as preparedness, and nurses accountability and responsibility as preparedness. But ultimately, there was a lot of consistency across the conceptualisations from the different healthcare professions. So what does this mean? It gives us insight into what our graduates think about preparedness for practice before and during that transition to their early work experiences. It's really important because if we now understand how they conceptualise preparedness for practice, we can prepare them for that transition that's about to happen. So moving forward, we need to think about that language and how we use it in terms of the curriculum and preparedness for practice as a term across the different disciplines. And this might also shape how graduates and students actually conceptualise and think about that preparedness for their preparedness for practice. We certainly encourage learning outcomes in curriculum that support that conceptualisation for learners and faculty. And I just want to leave you with this beautiful quote, which is from a nursing participant who, it's a conceptualisation about competence. And I think it just really sums up, you know, what it was like for everyone back at that point in time. There's my stopping my clock. Let you read that. Particularly that no one's going to catch you now, and just say thank you very much.